I'm Dorothea, and I'm so excited. I know most of you know me from Let's Talk Sarcoidosis. Well, guess what? We wanted to bring the people to you. We are doing Let's Talk Sarcoidosis on the road. So I want you to come in and join me and see what we have for you today. Today, everyone, I am in the office of Donald E. Thomas, Jr., and Dr. Thomas is a rheumatologist. You're also, Dr. Thomas, the author of the Lupus Encyclopedia.
Yes.
Can we talk about what is rheumatoid arthritis?
Rheumatoid arthritis is an autoimmune disease. First of all, it's important to understand that there's over 100 different types and causes of arthritis. Arthritis simply means inflammation and damage to the joints, and rheumatoid arthritis is only one of those 100 causes. It's a genetic disorder. People are born with the genes that cause it, and these genes cause the immune system to become overactive and attack the body itself. The immune system are the white blood cells of the body, and for example, an example of inflammation is if you get a bee sting, it becomes red and hot and swollen. Those are the classic symptoms of inflammation. And so just imagine if the immune system is doing that to the body itself. It looks at the joints and it doesn't think that the joints belong there. So it causes this inflammation, redness, heat, and pain and swelling of the joints. And over time it can actually destroy the joints. Like you've ever seen people with their hands that look like that. That's what rheumatoid arthritis can do if it's not treated adequately. Today, fortunately, many of our patients can go into remission with proper therapy.
Can we talk a little bit about osteoporosis?
Sure.
Yes, if we can talk about that.
We treat both arthritises and osteoporosis. First, I'll explain what rheumatologists are. We're rheumatologists, and our name comes from rheumatism and rheumatoid arthritis, but in reality, we treat all the arthritises. You can think of us as being the medical counterparts of orthopedic surgeons. Orthopedic surgeons treat these diseases with surgery. We treat them non-surgically. But another thing that we treat are bone diseases not related to the joints, and osteoporosis would be one of those. Osteo comes from the Greek word for bone. Porosis comes from the word porous. You can think of something having a lot of holes in it. And so imagine the bones having a lot of holes in it. They become very fragile and they can break. And that's how people break their hips and their spine as they get older.
So how is it diagnosed and then treated once it's diagnosed?
Osteoporosis is very easy to diagnose. We do a simple x-ray called a bone density x-ray, also called a DEXA scan. And it's a very simple x-ray we do right here in the office, just takes about 10 minutes, and then we can actually measure the strength of the bone from the bone density x-ray. And then if we do diagnose osteoporosis, we have medications which can actually make the bone stronger and prevent broken bones from happening.
Okay, because I've had that same test done, and I believe, I think you have to have it every couple of years, or I don't know if it's once a year, but because I'm still on prednisone, that it's a test that I definitely have to make sure that I don't have any broken bones or my bones are brittle and that kind of thing.
Absolutely.
Yeah. So I know where to come now when I need my next bone density test.
Well, except I will say and this is very important, it's always important to get your bone density x-ray done on the same exact machine every time. And the reason for that is that we have to be able to compare the bone density from one time to another, and it's going to be different on each machine. And so that's a really important thing, because a lot of people, they'll do just like you just mentioned, they'll get their bone density done somewhere else because it's convenient, but that's the wrong thing to do. So I'm glad you brought that up.
I'm glad I did too.
That's a good educational point.
So if you can explain the relationship between sarcoidosis and osteoporosis.
Sure. Sarcoidosis itself does not cause osteoporosis. However, a high percentage of people who have sarcoidosis also have osteoporosis. And a big reason for that is exactly what you just mentioned, the prednisone. A large percentage of people with sarcoidosis have to take prednisone, And prednisone is a steroid, and it decreases the bone density and makes them weaker over time, and it can cause broken bones if not identified and treated. So it is a big problem in sarcoid, but it can be identified, and we can prevent those broken bones from happening.
Okay, Dr. Thomas, can we talk a little bit about the similarities of lupus and sarcoidosis?
Sure. Lupus is my special interest. Was something I really have a keen interest in. It's related actually to rheumatoid arthritis. It's an autoimmune disease that attacks the body itself, except that it can attack almost every single part of the body. And that's the similarity with sarcoid. Sarcoidosis can affect every single part of the body, but they're two very different diseases. Sarcoidosis is a disease where the immune system lays down inflammatory cells called granulomas, and then these granulomas will cause organ damage in different areas. While systemic lupus is a disease where the immune system itself, the white blood cells, they attack different parts of the body and damage the body in a different way. Both of them can cause arthritis. Both of them can attack the lungs. Both of them can attack the heart. Both of them can attack the kidneys. Both can attack the skin and cause rashes. So sometimes it can be difficult to tell at first if someone has sarcoidosis or lupus, and the physician that's when he's trying to figure out when he first sees a patient, could it be lupus or could it be sarcoid? That's a very common scenario.
And what role does all the physicians play in treating patients? Because I think you had about 7 physicians that's housed in the center. Could be a little more, a little less, but can you tell me the roles that everybody plays working together as a group?
We're a group of rheumatologists, and so we all basically do the same. We see the same types of patients, and so we don't really do anything differently, but we are a group of 6 physicians and 2 mid-levels, and we all see all patients, but I have a special interest in lupus, so I do have a large lupus patient population, but I do see other patients with sarcoidosis and the other rheumatic diseases.
Wow, that's, when I think about pain, and I think about how patients can have a productive life and not live with the pain, what do you recommend, Dr. Thomas, when people are suffering with pain because of fear to come to a rheumatologist, or just not having enough information or education about what a rheumatologist can do to help them? What would you say to people that are watching about how they can live a productive life and not stay home and be in so much pain?
And that's a great question. With pain, one of the most important things is to first figure out what's causing the pain. Just taking pain pills or pain medicines is never the answer. You first want to find out the reason, because a lot of reasons are potentially treatable and reversible. And if you can treat the disease that's causing the pain, a lot of times you can make it so that the patient doesn't even need any pain medicine. You can get rid of the pain. So that's the first thing, is they should see a physician to figure out why they're having the pain. What is the disease process itself? And then is there a treatment for it? Can we reverse it? Can we get it into remission? And then we can address the pain part of it as well at the same time.
Now, is this something we can get results and we can let people know right now?
Yep, absolutely.
Okay, I'm going to expose myself.
I'm looking at your insides right now
no.
on the screen.